Hello guys, good evening. Welcome to one more Why Conundrum. In this Why Conundrum, we'll be discussing about why is there a dosing time difference between vancomycin and cefazolin in surgical prophylaxis. Okay, so here we have lots of questions to be answered, right? What's the first question? What exactly is a vancomycin? Second question, what is cefazolin? And the third question, and what exactly is the concept of surgical prophylaxis? First of all, we'll be decoding these nomenclatures. We'll have a basic understanding of what is these different terminologies. What is surgical prophylaxis? Before you plan to put an incision, any incisional surgeries, if it has been planned, before the incision has been put, we have to give a widespread or a broad spectrum antimicrobial before the infection is going to be spread out to land up in major infections throughout the body. That's what named as surgical prophylaxis. Usually, the surgical prophylaxis drug of choice would be cefazolin. Cefazolin, as the name itself implies, this is a cephalosporin. Cefazolin is a cephalosporin. Cephalosporin is an antibiotic. Similarly, we have vancomycin. Vancomycin belongs to a group named as glycopeptide antibiotic agents. Glycopeptide antibiotic, which is also, again, comes under the major class of antibiotics. Now, why is there a dosing time difference? First of all, how do we administer these two drugs, especially for surgical prophylaxis? So, whenever we administer cefazolin, it has to be administered less than or equal to 60 minutes from the surgery. So, we have to administer it just before 1 hour, or we can administer it within 1 hour of the time which we are planning to start the surgery. For example, if you are planning to start the surgery at morning 10 o'clock, 9 o'clock, at least from 9 o'clock, we can start administering cefazolin. But that is not the case in case of vancomycin. Vancomycin, we have to administer it 1 to 2 hours, at least like 2 hours before the incision is being put. Why is there a time difference between these two before the surgery is being started? First of all, you have to understand that the first difference is cefazolin is administered as a rapid IV bolus. It is administered as IV bolus, whereas vancomycin is administered as IV infusion. The first major difference. I hope you know what is an IV bolus is. You take up a drug in a syringe and you administer it directly into the veins with the help of a Venflon. Whereas IV infusion is, we just mix it up with the fluid and we start the drip as an IV infusion. This is one of the reasons why vancomycin is administered at least 2 hours prior to surgery. The second question again will go with why. Why? Cefazolin is administered as IV bolus, whereas vancomycin is administered as IV infusion. We'll go towards the next why conundrum. Why is this happening? It's because vancomycin is a drug. Vancomycin is a drug which will be named as a histamine liberator agent. Vancomycin is a histamine liberator. Liberator means that will release or increase the release of histamine from the stored mast cells. As we know, histamine is being stored in the mast cells. Whenever you administer vancomycin, this will increase the release of histamine from the mast cells. And again, why is this releasing histamine? Because vancomycin is an amine antibiotic. Not only vancomycin, any amine antibiotic for this reason will be named as histamine liberator, which means that will be releasing out histamine, thereby leading on to hypersensitivity reactions. Now comes the next important question. Okay, so what exactly is happening? Why is it very much important? Because it is releasing out histamine, vancomycin might be associated with something named as a hypersensitivity reaction. This hypersensitivity reaction was previously named as red man syndrome. Previously named as red man syndrome. But the name has been changed. It has been changed to red person syndrome. And why it has been named to changed to red person syndrome? Because not only in men, even women also will be landing up in this vancomycin related hypersensitivity reactions. Again, this red person syndrome nomenclature has been changed to vancomycin infusion reaction. vancomycin infusion reaction. And again, why this name change has happened? Because the red color discoloration of the skin is difficult to make out, or was difficult to identify if a patient is black. So, simple one, if a patient is already dark skinned, it is difficult to make out the red discoloration. So, they have changed the name to vancomycin infusion reaction. In fear of this vancomycin infusion reaction, which is pretty much unpredictable, we don't know which patient will develop this vancomycin infusion reaction. It is always advised to administer this drug as slow IV infusion, not just IV infusion. We're just adding a feather to the cap. We're going to be adding a terminology slow. So it is administered as slow IV infusion. So what are the things which we have learned till now? 2 points. Vancomycin is a drug which is an amine antibiotic. It is a histamine liberator. It will release out histamine from the mast cells. Because of it, patients might land up in hypersensitivity reactions. It is currently been named as VIR, vancomycin infusion reaction. To prevent this thing from happening, vancomycin is always administered as slow IV infusion. Okay, sir. What if you start the patient on slow IV infusion and the patient develops vancomycin infusion reaction? What is the next best step in management? For example, just imagine you are there in your ward, a patient is admitted, and you are being asked to put vancomycin infusion. You mix up vancomycin in the fluid and you start the patient on vancomycin infusion. But after like 2 minutes or like 3 minutes of time, his upper body, that is the primary site of where we can see the vancomycin infusion reaction. The upper half of the body is more prone to land up in reddish discoloration. There will be flushing, which is both are one and the same. There will be flushing and it will be warm. So the upper half of the body is extremely warm and we can see the body is turning red. This is explained as vancomycin infusion reaction. What is the immediate next step in management? Simply just stop administering. The next best step in management is just stop administering or stop the infusion. Just close that IV set. Wait till this vancomycin infusion reaction is getting corrected. Mostly it is self like cleanable. But if you want, you can administer an antihistaminic agent. We can administer an antihistaminic agent like AVIL, like CPM can be administered, or even any other parenteral, any other injectable forms of antihistaminics can be given. Once after administering antihistaminics, one the red color discoloration is getting weaned off, one the warmth is getting weaned off, we have achieved the complete control over the histamine release. Now we can restart the vancomycin as slow IV infusion again. Even though if you administer it as slow IV infusion, we have to restart it at extreme slow, which means the number of trips per minute is going to be very much lesser. Well, that's how we have to manage vancomycin infusion reaction. In fear of this VIR, we should always administer here. I'm repeating those two different terminologies. What are those terminologies, buddy? First one is slow IV infusion. Here also again we have written slow IV infusion. So it will take at least for around 2 hours for the infusion to get complete. That is the reason why vancomycin, whenever it is administered, we have to start the infusion 2 hours before surgery. Cefazolin, which is administered as IV bolus, it is not a histamine liberator because it is not an amine antibiotic. Very much simple. It is not a histamine liberator. It will not release histamine. So cefazolin can be administered just 1 hour before surgery. That's the take home point, guys. That's what about your today's why conundrum. Why is there a dosing time difference between vancomycin and cefazolin? Because vancomycin is associated with vancomycin infusion reaction. To prevent it, we have to start the patient on slow IV infusion. It will take at least 2 hours of the infusion to get completed. So we have to start the infusion 2 hours before surgery. Whereas cefazolin can be administered as IV bolus, it will not release it will not produce any hypersensitivity reaction. There will be no histamine liberation. That's why it can be administered as IV bolus. Even though it is administered as IV bolus, it is administered for a period of 5 to 10 minutes up to the max. Slow IV bolus for around a maximum of 5 to 10 minutes. And we have to keep the patient and ask for the surgery. The surgery has to be started before a period of 1 hour. That's it for today's Y conundrum. We'll meet up in one more Y conundrum early. Bye-bye.